Hello folks and good morning. It's Dr. Mike and we're back here for our next edition of 30 for 30. It's October 26th, which means it's our 26th installment of 30 for 30. And we're back here with our medical exercise training client management system. We've talked about the initial contact and the initial session. We've talked about the assessment, the post-assessment. Last session we talked about the training session. So now we're going to talk about the progress report. So now you've assessed the client. After you've assessed them, you've put together your goals, you develop the exercise program, you've scheduled sessions. Now you're actually training the client. So you're actually having training sessions with the client. But periodically, you need to send a progress report to their doctor, therapist, or chiropractor. And folks, let me say this about the progress report. The progress report is probably the best piece of marketing that you can do to attract referrals from doctors, therapists, chiropractors, insurance carriers, occupational nurses, any medical professional. They like progress reports. As I've said before many times with 30 for 30, with everything in medicine, there's a paper trail, whether it's a hard copy paper trail or a digital paper trail. We must send progress reports to update people with regard to what's going on, and the magic number is 30 or 30 days. Pretty much every prescription lasts 30 days. Every procedure, we need to go back and review what's going on 30 days later. So with the progress report, your standard on this is to send a progress report every 30 days or whenever the client is going back for a follow-up visit with their physician, the therapist, or the chiropractor. So every 30 days should be the standard, but if they're going back, say, in 17 days for a follow-up visit, the progress report needs to show up there. Now, the progress reports are important because, yes, it's a great piece of marketing, but think about it. You go to a doctor, you've got a knee injury. He decides or she decides they want to get an MRI. You go out and get the MRI done. They schedule a follow-up appointment 4 days later. You go back 4 days later and the MRI report isn't there. Was that a waste of time? A waste of the doctor's time? A waste of your time? A waste of a visit? And you probably had to pay for it too, your copay. So wait a minute. You want to get that report so the doctor can determine what course of action to follow now with regard to your knee injury. Same thing holds true here. If the client has been referred to you by a physician, a physical therapist, a chiropractor, and they're going back for a follow-up visit, you need to be professional enough to say, hey, Dr. Smith or Dr. Jones, here's what's going on with our client. Now, there's an art form to actually writing progress reports. And the progress report should go back and reflect on the functional deficits and the baselines that you found in the initial setting. And they also reflects back on those short-term and long-term goals. So this progress report should be no more than one page. Folks, years ago, I bought an isokinetic testing system in one of my physical therapy offices. It spit out a report that was color and different color inks and everything. And I asked a local orthopedist if he had gotten one of the reports I sent him. And he kind of laughed at me and said, yeah, I got the report, but I didn't read it. He said, I don't have time to read 8 pages. And suddenly I realized physicians, therapists, chiropractors, they're busy. Make your progress report one page. And in this progress report, you're basically going to address things such as flexibility, function, strength, endurance, stability. Yes, pain, but don't focus on pain. Focus on things that are actually more objectively measurable. And that's where we go back to those functional outcome measures. What we want to do is look at those functional outcome measures and report the client's progress with those. But now remember, with functional outcome measures, A1C, bone scans, things of that nature, you're going to need to get the doctor, therapist, or chiropractor to give you the results of those. And more importantly, I should say, the physician to give you the results on those. That's why it's important in this initial session to get that medical release form signed so that the client is giving you authorization to communicate with the medical professional to obtain their information that you're going to use in writing this progress report. Again, one page. And it addresses the deficits and goals that you found in the assessment, okay? You're going to note the exercises and activities that you're doing with the client. You don't have to note every exercise and every activity, but in general, the major exercises and activities. Also, any limitations or precautions that you're taking with the client. Also, your recommendations with regard to the program. Should the client continue twice a week? Do you think the client would benefit from Pilates exercise, maybe yoga? Do you think the client might benefit from maybe massage? The medical professional is looking to you for your exercise expertise. They're not exercise experts. They're experts in oncology or in physical therapy or in surgical procedures, not in exercise. They want your expertise in those areas. So give them program recommendations. And also notice what we have here, your plan of training. outline what your plan is. Do you want to continue with the client twice a week for the next 4 weeks? Do you want to eventually move the client into a small group program or maybe into a medical membership? So note your plan of training. And again, every 30 days or when the client is having a physician, chiropractor, or physical therapy follow-up visit, you produce a progress report. That progress report needs to make it to that medical professional's office before the client goes back in for that follow-up visit or before the 30-day mark. It arrives on day 28 or day 29 or at minimum the day before the client goes back for the follow-up. Now, let me make sure you understand. When that progress report gets to the office, it comes in, someone's going to pull that individual's chart. They're going to take that progress report and affix it to the front of the chart and put it on the responsible medical professional's desk. That medical professional is going to have to review it because this is information on one of their patients. They need a licensed individual to review that report to say, okay, we understand what's going on so that we know that there is nothing major or major problem here. We want to make sure we're looking for red flags. So that progress report now puts your name at the bottom of that letter. You're writing John Smith, MES. You're going to put your contact information in your letterhead. So every time that progress report goes over, you're solidifying your relationship with that doctor, therapist, or chiropractor. That becomes vitally important. Now, folks, I'll tell you a little story. Years ago, when we first started dealing with personal trainers back in the early 90s, we had a young lady who left our practice. We discharged her. She found a personal trainer, called back, asked if she could work with a trainer. I was like, sure, it'd be great. I never heard from the trainer. But eventually the trainer sent a progress report, just an update on how well the client was doing with their exercise program. I didn't solicit it, I never spoken with the trainer, but I thought, wow, this is a pretty high level of professionalism. And I thought that subconsciously, it wasn't in the forefront of my mind. But a few months later, when we had a client that came in and asked if she could work with a personal trainer when we discharged her, I sought out that patient's chart and found that progress report. And with finding that progress report, we were able to get that young lady's, the trainer's number and contact information off that progress report, and we referred the client out to that, to her for those services. So this idea of progress reports, this gets past the gatekeeper, it gets past the front desk, it gets put on the chart, and the more progress reports you do in an appropriately timed manner or time frame, the more that medical professional is going to get to know you. And folks, over the years, I've had dozens of physicians that have referred patients and never met them in person, but the correspondence was always via progress reports. So it makes a huge difference, okay? So the progress report becomes important. Now you'll notice here, after the progress report, we have a summary of the MET management keys. We're going to go over that next time. But please understand, the initial contact and initial session, the assessment, the post-assessment, scheduling the sessions, the actual training sessions. Now we've talked about the progress report, and tomorrow we'll talk about a summary of all of this with the MET management keys. So it's important, progress reports. This is something we must do. It will bring great light to the great work you're doing out there as a medical exercise specialist when you start sending progress reports. I ask this question in all of our MES courses. How many of you have worked with clients with hypertension, diabetes, low back pain, or some type of joint dysfunction? And you've worked with them and they're doing better. Everyone raises their hand. My next question then is, how many of you have sent progress reports to the doctor, therapist, or chiropractor? One hand goes up. You're doing great work. Your clients are going back to their doctor, therapist, and chiropractor saying, Joe Smith is doing a fantastic job with me. Okay, the doctor's like, okay. But with no progress report or no follow-up in-person visit, your work is great, but you're nebulous. You're just a person floating around out there. So please, if you would, start doing these progress reports. It's a vitally important component of this medical exercise training client management system, and we'll be back tomorrow to talk about the keys and a summary. So thanks for listening in. Please go over to MedX Pro 360. Check out our information there, our community for medical exercise professionals. We'll be glad to have you involved, and have a great remainder of the day. We'll see you tomorrow, folks. All the best. Bye-bye.